All right. So, ma'am, we are live. Just waiting for some participants to join in, and then we'll start.
Okay.
So, hello and assalamu alaikum to all the viewers. Hope you all are doing well. I am Novera Rehan, and currently I'm pursuing my bachelor's degree in biological sciences from SZABIST, and I'm also serving human resources in SZABIST Biosciences Society. And on behalf of SZABIST, I would like to welcome you all to this awareness session on breast cancer, and I'll be your host for today's session. So, today, Zabist has chosen the topic of breast cancer for the webinar due to the fact that breast cancer is among the most prevalent cancers in the world and among the most common cancers in women. Breast cancer mortality rates in Pakistan are said to be the highest in Asia, and this can be because most of the women of our country are, reluctant to talk about any abnormality in their breasts or to seek medical assistance. Breast cancer is treatable, largely treatable, especially when it is detected at an early stage. But if women will be ashamed to talk about it with doctors, then this will lead to some serious consequences. Therefore, today's session aims to educate the public about breast cancer, its diagnosis, possible treatments, possible risk factors that are involved, and very importantly, to help destigmatize breast cancer. So now moving forward, I would like to introduce our today's guest speaker, who is Dr. Zubia Masood. Dr. Zubia is an associate professor consultant general at Ziauddin University and breast and laparoscopic surgeon at Dr. Ziauddin Hospital, Karachi. She has 15 years of experience in the field of surgery, and she has also worked at Dow University and Hamdard University, and is also associated with 𝗕𝗥𝗘𝗥𝗁 Cancer Hospital. So yeah, hello, assalamu alaikum, and welcome, Dr.
Assalamu
Zubia.
alaikum. Thank you so much for the invitation, Novera.
How are you, ma'am? Hello. Zubin, your voice is a little distorted.
Can you hear me now?
Perfect, perfect. So, shall we proceed?
Yes.
So, ma'am, most of us do know what cancer is in general, and that it occurs when cells um, grow abnormally and uncontrollably. But could you please brief us all on what breast cancer is, how it occurs, and signs and symptoms and all of that?
As you were telling Novera, that breast cancer is a cancer which happens in for your body. This is something which happens for anywhere in the body. As far as the breast cancer is concerned, it's just like any other cancer. But yes, if breast cancer is diagnosed at an early stage, that's absolutely curable, most of the cases. So when you talk about the signs and symptoms, the women need to know that they have to check their breast. For example, if there is any recent change in the size of the breast, if there is any lump which they can feel, if there is any bloody discharge from the nipple, then it is possible that the patient can examine themselves and get a consultation. So this is the first
Ma'am, I'm sorry to say, but your voice is a little distorted again. Can you please repeat?
I was telling you that for the women have to examine themselves. They need to know about different, any kind of signs, just like if there is any change in the size of the breast, if there is any lump which they can feel, any skin changes, any lump in the axilla, or if there is any bloody discharge from the nipple. So all these things can lead to CA breast. So they need to examine their breast and they have to keep an eye on it.
Ma'am, what could be the initial symptoms that how one can detect it and when to see a doctor?
The very initial symptoms is actually when you cannot palpate a lump. And that is the reason the screening mammograms are being done. The very early tumors are not detected because they are not palpable. And for diagnosing them, screening mammograms are being performed. But once the lump is palpable, even by a patient, it's big enough most of the time. But still, the patient can come and get a consult from the doctor or the specialist and get a consultation. And then they can examine themselves and get a consultation.
And ma'am, are these lumps painful or not painful?
Acha, the breast lumps which are painful are mostly not malignant. And most of the patients, they come to us with painful lumps, which are not malignant most of the time. The lumps which are not painful are malignant most of the time. So the patient should not neglect a lump if they think that it was not painful. This is the very common mistake when they come late and they say that they did not felt any pain and that's why they were not coming for a consultation. So the patient should not neglect a lump even if it's painless, because malignant or the CA breast is most of the time painless.
And what are the types and stages of breast cancer?
There are different type of breast cancers,
Serious stage.
but as I was telling you in the beginning, that since if it is diagnosed early, then it's very much treatable and curable. As like you broadly just divide them. There are four stages. Obviously, the first and the second stages are early cancer stages, which are curable. The third stage is a little advanced, and the fourth one is when the cancer is metastasized into the body. Okay, where it is going into the viscera or the bones or the brains or anywhere else. Even in such a situation, the systemic therapy or the chemotherapy can be given to decrease the pain of the patient or to decrease the tumor load. But in such cases where it is spreading to other parts of the body, it is not 100% curable, but the 5 years life expectancy could be between 10 and to 30%. But in the first stage, it's almost 99 to 100%, where 5 year survival is almost 100% in early cases, and so goes in the second stage. But that will going to include the chemotherapy, that will going to include the radiation therapy along with the surgery.
And ma'am, what can be the possible risk factors for breast cancer? Like, uh, what are those factors which can, increase the chance of developing it? And can it be diet or genetics or chemicals or any environmental factor?
It was just day before yesterday when we were having a CME, and there's a lot of myth in the Eastern countries that This is the disease of Western countries because they don't do a lot of childbearing, they don't lactate their kids, they don't feed their kids. But this is no more a reality now. This is absolutely a myth, because even in Asian countries, the prevalence of the disease is very high. In Pakistan, one female out of 9, they have got a chance of developing CA breast in lifetime. And even in the Asian countries, we have got a higher prevalence of disease. The reason is that, one, as you were saying, that risk factors, what are those risk factors which are increasing and why we are having it? Number two is that, unfortunately, in our part of the world, the females are also a little negligent. They've got a negligence towards themselves. And even the society doesn't give much, uh, importance for these kind of patients. So the risk factors, there are two type of risk factors. One is which you can't change. For example, breast cancer is more common in females, so you can't change your gender. Breast cancer can be associated in the genetical or genes, so you can't change the family history. And it is more common in the females who has got an early menarche and late menopause. So the more the hormone influence, the more chances for having the CA breast. You can't change the early puberty and you can't change the late menopause. But yes, there are factors which you can change, just like smoking, healthy lifestyle, obesity, having children or planning children at younger age, and lactating them and feeding them. So, with quitting or the smoking and not taking the alcohol, having a good healthy lifestyle, good diet, you can prevent this. Apart from that is that it's also associated with hormone replacement therapies, which were given in the perimenopausal females, where or estrogen therapies were being given. So that was also be associated with the CA breast. So now those drugs are also modified. And even in the childhood or your younger age, if you are exposed to the radiations, then you are also prone to have a malignancy, CA breast in the later in your age. So all these factors, there some of them are which are modifiable and some of them are not modifiable.
And ma'am, what happens when, there's this need to remove the breast? Like, why is that? When does that happen?
When there is a cancer in the breast, you have to remove the cancer. So now that depends on the staging or the disease when it is diagnosed. That in the early cancers, you can just remove the part of that breast. Even with the advent of the recent advances, with a lot of recent radiations and chemotherapies and better follow-ups and better education and awareness, you can give a chance to the patient where they can save their breast, and you call it as a breast conservation surgery. But surgery is something which you have to do either in the case. So in that case where you have to save the breast, there are certain contraindications where you can't save the breast, but there are indications where you can save the breast. And even you can go for some reconstruction where you can use either the implants or the part of your own body, which can be used to make the bulk of the breast. So that is the breast conservation, and then you can reconstruct it also.
Right. And ma'am, what are the possible treatment options for breast cancer, and are they easily accessible? Like, and which one is the
See,
most effective?
yeah, see the patients, actually the cancer treatment is expensive. It is expensive throughout the world. As I was telling you that previously there were times when the surgery was the main game for the malignancies and all. Then came the chemotherapy and radiations and everything. So with multidisciplinary, you can do a lot. And the patients have got, and we have got a chances for saving the breast also. But yes, the treatment is expensive, and that comprises, as I was telling you, the chemotherapy or the hormone therapy or the radiation or the surgery. So this is a multidisciplinary approach where the team works, and this is how we manage the patient. And it is available in Pakistan, and most of the agents, the very recent agents, even they are available here. But definitely the cost is higher in more advanced chemotherapeutic agents. So that is something which is up, It's not a problem, but yes, everybody cannot afford it. But in our part of the world, there are lots of NGOs who also support. There are hospitals who are serving as public sectors, and there are even hospitals who are supporting in the private hospitals, the NGOs who support the CA breast patients and they treat them.
And there's no drug or medicine to treat the cancer?
The
Like,
chemotherapy
is
is
there?
basically, yes, the chemotherapy is the drugs. There are different drugs which are being used. All these are like, this is a kind of a medical treatment, and then is the radiation treatment. So these are the drugs which are being given.
All right. Last but not the least, ma'am, how can we create awareness among women? Because
Novera,
right,
just what you are
women
doing it.
usually, our country, yeah, the
See,
sessions, awareness sessions.
in my career, from a time when I was a trainee, and the patient were used to come to us when they had, the cancer was rotten and they had maggots in their breast, and that was a time when they were used to come, okay, Dr. Sahab, just take out these maggots. So, and that's not very long ago. And due to the awareness, I can see the ladies coming to us because, in our part of the world, the kind of society we are here, people doesn't talk about their breast. The ladies are not supposed to talk about it. Our social setup was very different, but over the past few years, a lot of awareness has been generated and created at every level. I can see that every year from one or the other offices. It's not only the hospitals or the CMEs we do for our medical students or our junior doctors, but every office, the people are trying to create awareness. They are inviting the surgeons and the doctors. They are trying to learn the breast self examinations, the social media, civil societies. A lot of people are doing a lot of work. And yes, definitely, I can see the change in the attitude of the patients. They are trying to come early. They try to get the consultations. They are not, even the family. I can see the support from the family, from the male side, because unfortunately the females are very much dependent on their male partners, their husbands or the fathers and the brothers. And I've seen a lot of even educated patients who are not coming ke हमें बहुत शर्म थी कि हम अपने बेटे को कैसे बताते, the very old females के how could we tell के मेरे breast में कुछ हो गया है, and then they end up in a metastatic disease. But with awareness, definitely there is a paradigm shift and need more to do. But yes, that has created a lot of awareness, and it's good to see that patients are coming to you when they say कि हमने कहीं देखा था, हमने सुना था, टीवी पे आया था, रेडियो पे हुआ था, तो हमने सोचा हम जरूर एक दफा एग्जामिन करा लें. So this is really a pleasant feeling that the patients are coming to you and they're thinking about themselves. So yes, media created a lot of awareness, and it's pleasant to see it.
Yeah, so that's really important to, uh, to go for checkups, to detect it
Yes,
at an early stage, in
yes,
order to, be safe from other
yes,
uh, harmful treatments. So,
yes,
yeah, it's very important to get screened, detect it early. So,
yes.
all right, is there anything else, ma'am, that you would like to add to this
It's just
information?
as I really request each and every, the females, the ladies, the girls, that they should pay attention to themselves. They should do the examinations of their breast so that if any such thing can happen to them, and they should also try to learn. On the YouTube, on the social media, a lot of breast self-examination videos are available. You can go to any doctor and you can learn, because in the Western countries or in the advanced medical treatment, the breast self-examination doesn't exist as a very good modality. But when we are having patients who has got an advanced disease, it's better that at least they should examine themselves or get themselves examined by a doctor at least once a year, so that their tumor can be detected early. The screening programs should be run, like 40 plus females, they should get a yearly screening mammograms so that the early tumors can be detected for the better cure, better outcome, and better health. So this is it, that they should take care of themselves, and I think it has started. I can see the change, and it's clearly present.
All right. So, with this, I would like to notify you all that Dr. Ziauddin Hospital is offering free breast checkup and 20% discount on laboratory and radiology tests. And this offer is valid till 15th of November 2021 for their North and Clifton campus. So, go get yourselves checked, avail the discount, get the screening done. And if you're suspicious of any lump, or if you know anybody who who might be needing it, so go tell them, help them. And yeah, that's about it. So first of all, thank you so much, ma'am, for taking out time from your busy schedule to be the guest speaker at our webinar today. We were just having this conversation on Sunday that I was just asking a question from Dr. Zubia, and I wrote, "I'm really sorry to disturb you on Sunday," but she replied that there's no Sunday for us. So it's a very noble profession. I salute you. I salute all the survivors, all the cancer patients, and I pray that they get well soon. So, yeah, and we are pleased to
Inshallah.
have you, ma'am, on the session. I learned a lot from today's session. I hope it was informative for everyone as well, for our viewers as well. So,
Always welcome, Navera, and thank you very much for giving me this opportunity to come here and try to give some information so that it can work for the people. Thank you very much.
thank you, ma'am. Take care. Thank you, everyone. Take care. Allah Hafiz.
Same to you. Allah Hafiz.